Welcome to CivilNet. My guests today, both from Boston, are two physicians who are here to embark on a very interesting and I would say really essential project for Armenia and Armenians. Welcome Dr. Viken Babikyan from Boston University Medical Center and Dr. Maher Artinian from Tufts University Medical Center. You guys still speak to each other, huh? It's okay.
We do.
Universities.
We think we're better, but we still talk.
Dr. Babikyan, Viken, let's start by you're telling us what you're doing. Let me just say it briefly. You're setting up a stroke center here in Armenia as a collaboration between the Armenian Medical International Committee and Yerevan Medical University, Yerevan State Medical University.
Indeed, that is the idea.
What does a stroke center do?
Stroke treatment has evolved a lot over the past 10 years, from surgery to medical treatments. And it's not only that we have medications, but how we present the medications in a timely way to patients. So there has to be a system, a structure in a hospital that provides it. The idea of today's meeting or the next 2 days' meetings is to create that, to establish that.
You said something. You said the right medication in a timely manner.
Exactly.
And as far as stroke is concerned, those two are equal issues.
Time is brain. The longer it takes for someone who has had a stroke to get treatment, the more brain tissue is damaged. And we're talking in minutes, not in hours. So someone who has had a stroke should be in a hospital now, immediately. And the sooner they can get to the emergency room, the better off they are. That's a part of the patient. And our part, Dr. Artinian's and my jobs, and Yerevan State Medical University School's job is to have the hospital ready when a patient presents to the emergency room.
Dr. Artinian, you're working with professionals here in Armenia who are going to collaborate with you to not just set up a center, but to also introduce a new kind of thinking as far as stroke treatment is concerned. If the layman summarizes your two challenges, it seems to me, let's assume that you and your colleagues here are all on the same wavelength. Let's assume that from the get-go. It seems to me you have two challenges. One is to convince all of us of the timing aspect of this.
Correct.
And the other is to ensure that the diagnosis at that point of
is made correctly.
So one is public information as much as anything else. The other is working with specialists. Tell us about the specialists and then let's talk about the public part of this.
I mean, once we make a diagnosis of stroke, and most of it is clinical, so where the imaging component comes is to make sure there's no hemorrhage or bleeding so that they can start the medical treatment. That's where the neurologists come in.
So if that part of the decision is incorrect, you end up making...
Because it's very could be life-threatening if you start the treatment in a patient who has a hemorrhage.
Is there sufficient capacity, training in Armenia to assure that kind of ability? Is that something that this program will also offer?
Well, there is some basic information and available information. Our job is to make that, to bring it up to date, and so that everybody is on the same wavelength. That's where the stroke center comes in, and time becomes the essence. Whether it's this university or that university, once you create a model, people can follow that model and establish it in other hospitals as well.
Let me ask the same question a little less politely. In Armenia, as I assume everywhere, the key is to trust your medical professional. So in Armenia, you want me, the potential victim, to do two things. A, you want me to not go to the nearest hospital, but to go to the stroke center, which may be a little bit farther.
Yes.
You also want me to trust that professional enough to do what they say and not what my family doctor says. So you're telling me that professional's prepared, that diagnostic ability is there.
I think so. I think Armenia now has the technology and has expertise, the professionals who have that knowledge base to provide it at specialized centers. Now, even there, though, you need to integrate this together. To have an MRI machine does not necessarily mean that it's done in a timely way and that the doctor who has the information is the doctor who's going to use it for the patient's benefit. Our job comes there. What we are trying to establish now is to create that working machine, if you want, between specialists and machinery and hospital structures. So in response to your question, I do think Armenia has specialists and has technology, and we're getting there. We're moving in the right direction.
So all of the pieces necessary to make this work are there.
Yes, or the pieces are.
So what is left is will, attitude. Is the human factor the one that's going to make this work?
Indeed, I may have a medication at home in my kitchen, but if I don't take it, it's not going to help me. So the fact that there are people who can help doesn't mean that they're going to help everyone. And keep in mind, if there is one center in Yerevan, it doesn't mean that center can help something that happens in Gyumri. So not only we have to establish a first center, then there has to be a second and a third and a fourth, because the whole country needs it. There are some epidemiological data about stroke in Armenia. It's quite common.
I was going to ask. It's quite?
It is quite common. These are Armenia government data, Ministry of Health data, and there is a substantial mortality from stroke. And
preventable.
Substantial mortality from stroke in Armenia, and that number can be brought down with better treatment. So that is our job, to make sure the better treatment gets to people. If I can say it a little bit differently, there is good treatment. The key is to get it to people. And that is our job. And part two of what you're asking, a hospital can be very good, but there has to be a citywide, countrywide system that helps it happen. And that's where political will, organizational skills, and all of that sort of thing have to come in. So our job is to help Yerevan State Medical University Hospital to work better. But at one point or another, the Ministry of Health or the government of Armenia will have to weigh in to decide what is in the best interest of Armenia in terms of organizing the whole country.
So bottom line, we all need to know that speed matters, and the professionals involved need to buy into the idea of not taking me to the most obvious place, but to the right place.
Right, in answer to interrupt, like you said, whether it's this center or that center, if the patient is from Yerevan and there's a 911 system like we have in the States, and it doesn't matter whether it's 2 blocks away or 5 blocks away, as long as it gets to the right center.
How has this been taught? How has this been learned in other places in the world? Is it simply the right messages, the right public messages, the right medical community decision? Is it that simple?
No, there's a learning curve, and it has taken in the US probably 10 to 15 years to get to where we are. And the idea that we're going to fix things in Armenia and one day is not going to happen. There will be a learning curve here too. But of course, Armenia has now the advantage of seeing what happened in Western Europe, what's happened in good places in Russia and the US, and to bring that in a more effective way to make it work in Yerevan. So I think we have experience to use, to learn from, to apply it better in Yerevan. So we have a little way to go, but we have the basic elements of this there to build it up.
We wish you luck.
Thank you.
Patience, determination, and some more luck. Dr. Yerevan, Dr. Viken Babikyan embarked on a new mission to establish a stroke center here in Yerevan first, and hopefully other places in Armenia as well. Thank you for joining us on CivilNet and helping us tell the rest of the world about this.
Thank you.
For your time.
And thank you for following us on CivilNet.